We continue treatment of the neck from the front and side aspects, where two incredibly important muscle groups for neck alignment, posture, and comfort are typically neglected. The scalene muscles are a group of 3 muscles on each side of the neck, identified as the anterior, the middle, and the posterior. The sternocleidomastoid muscle is one of the largest and most superficial cervical muscles. In my experience in having treated over 1,000 patients for neck injury, successful treatment of these muscles is critical for a full recovery. The best way to approach this treatment is to think that one thumb is pushing deeply on the front ridges of these muscles, as this massage therapist is executing in this image, with approximately 1/3 to 1/2 of the fin blade making contact. The number of sites worked on is up to the user, but in the following diagram, 7 sites are shown. You will work down the scalenes first, from the jaw to the collarbone, then back up again after shifting the site to the side slightly. Finally, you will work down the sternocleidomastoid. You will not use the lever plate during this technique, only using the Orca fin blade plate by itself. This technique requires a bit of precision to execute correctly. The first 6 sites in this diagram will only make contact with 1/3 to 1/2 of the fin blade. However, the last site, just above the collarbone, the 7th in the diagram, will make contact with the entire fin blade. Do note that the AcuLever is at a 45-degree angle to execute this technique. It may shift slightly as you work to conform to your neck. Lay face down on the floor or table with your arm to the side, with the fin blade plate at a 45-degree angle. Bring the opposite arm up to a place where you can use it to raise and lower your body. The first site is very easy to locate, literally the first area of muscle just below your jawbone. Lower your head slowly onto the AcuLever, aiming the tool so it catches the front ridge of the scalene muscles. You will rest here for as long as it feels appropriate to begin the opening of the site. After this initial direct pressure, lift your neck upwards and inch forward with your body. You will be resting on the second site as indicated in this diagram. Smaller increments between treatment sites will lead to a better result, so do not move forward too far. Depending on your height, the increment between sites is 1/2 inch to 1 inch. However, the more sites, the more thorough the treatment. When you do reach the collarbone, this is the site that will use the entire blade. It is recommended that you rest at this site to open it deeply. You may feel stimulation of the nerves in your arms, which is quite normal. To move the fin blade to the second set of sites, shift your body less than 1/2 inch away from the tool. The blade is still making contact with the scalene muscles, but has slightly shifted to the outside. As you walk up the neck on this track, the blade will make secondary contact with the sternocleidomastoid through the scalenes. Once you complete the last point at the jawline, flip the tool 90 degrees, as shown in the video. Shift the tool to this last line of neck sites. Once turned to this orientation, the tool should be making strong contact with the treatment sites on the side of the sternocleidomastoid. You may need to adjust the blade or your body slightly to fine-tune the strength of the cut that the tool is making. Continue in similar fashion down the neck to the collarbone to complete this routine. It is advised to rest at the last site just above the collarbone and apply deep pressure there for at least 30 seconds.